This lecture today we are going to study about module 5, that is clinical study reports. So this is module 5 of CTD, and the guideline recommends specific organization for the placement of clinical study reports and related information. तो ये guideline जो है basically it specifies an organization for the placement of how you have to place the clinical study reports and whatever related information is, in order to simplify the preparation and simplify the review of that particular dossier, and to ensure completeness, because that they always initially check for whether the document is complete or not. If it's an incomplete document, they send it back. The placement of a report should be determined by the primary objective of the study, okay, and each study report should appear only in one section. So if I'm talking about, for example, if I'm talking about efficacy report, then it should be contained in that particular section only, where they'll ask you to give efficacy information about a particular indication. Where there are multiple objectives, the study should be cross-referenced in various sections. So you should not copy, paste and duplicate. Just refer. If suppose in elsewhere, like in safety data, you are having dual objectives, or it's asked of you to provide with the efficacy, then you just cross-reference and refer section so and so for this particular thing. So in their terms, in module 5 there are total of so this is module 5, right? It has total of 4 subsections, or you can say sections, not subsections. So the first one is table of contents of module 5. Next is tabular listing of all clinical studies. Third is clinical study reports. What all clinical study reports do they ask from us? And fourth is literature references. So this is out of like if you ask me, I would say module 5 is a tad bit important, although all the sections are equally important. But basically it asks you for the information about what actually your drug has, because it's going to show about the biopharmaceutics, it's going to show about PK/PD study reports, it's going to show about safety and efficacy reports, it's going to tell you about the consent case report forms and the reports of post-marketing experience as well. So you need to have, because this will be your kind of like answer sheet of an exam paper. So module 5 of CTD is to be studied with great importance. So this is the sections present in module 5, and you will find this is because set up by ICH, so it's a universal concept followed in countries like Europe, USA, Japan, Australia, etc. So first one will be your table of contents. For module 5 in ECTD, it's not mandatory to have this. Tabular listing of all clinical studies, clinical study reports and literature references. So our interest would be for this one. So we'll see now. If like I'll write in very I'll give a like how these sections are made. They're 5.1. okay, let me write it here only. So this is module 5, right? So this section will known as 5.1, table of contents of module 5. This will be 5.2, tabular listing of all clinical studies. 5.3, clinical study reports. And 5.4 is literature references. So we will look in detail about 5.3, that is clinical study reports, what this section has for us. So 5.3 has how many? 7 subsections. Let's look at those 7 subsections first, because if I'm going to write the whole table, and you can find that table online as well, it's going to be a very haphazard manner to explain. So it has 7 sections mainly. So obviously if the section is 5.3, the subsection would be 5.3.1 to 5.3.7. And what are these subsections? So 5.3.1 is reports of biopharmaceutic studies. Then 5.3.2 is reports of studies pertinent to pharmacokinetics using human biomaterials. Then 5.3.3 is reports of human pharmacokinetic or PK studies. Similarly, in 5.3.4, you will have reports of human. Can you guess what it would be? So it would be human pharmacodynamic, that is PD studies. So that is how we will remember this. We'll not mugify it, we'll learn it by logic. And then 5.3.5 contains reports of efficacy and safety studies. And 5.3.6 is reports of post-marketing experience. And 5.3.7 would be case report forms, that is CRF, and individual patient listings. So these are what the section of the 5.3 clinical study reports include. So in the first subsection, they talk about reports of biopharmaceutic studies. Okay, whatever biopharmaceutic studies there will be. In the second subsection, they talk about pharmacokinetics, but those studies that were used by those studies pertinent to pharmacokinetics using human biomaterials. Then 3 had actual human pharmacokinetic studies, and similarly human pharmacodynamic studies, PD studies and PK studies. Then obviously efficacy and safety would be there because we are talking about the clinical module. The module 5 is about the clinical module, and then reports of post-marketing experience is there, and case report forms are there, and individual patient listing is there. So we have learned, see, you don't need to mugify this module by heart. You just have to have the general idea that if someone asks you that efficacy का और safety का data कौन से module में रहता है, तो it is very obvious that it should be present in module 5. So you don't need to mugify it word by word because ये करने की ज़रूरत भी नहीं है. ऐसा नहीं है कि आपको कहीं Google पे या guidelines पे नहीं मिलेगा. आप जब भरोगे modules तो obviously you'll have to follow the guidelines. You won't fill it out blindly. So this is not an exam, but logically आप सोच के देखो कि clinical study है, तो obviously in clinical studies they would be talking about humans. तो यहाँ पे पूरी स्टडी, ये एफिकेसी सेफ्टी स्टडी भी ह्यूमंस पे हुई होगी. सो ह्यूमंस का बायोमटेरियल यूज करके फार्माकोकाइनेटिक स्टडी की, फिर एक्चुअल फार्माकोकाइनेटिक स्टडी ऑन ह्यूमंस एंड फार्माकोडायनेमिक. दीज आर क्वाइट इंटर रिलेटेड. द एक्शन ऑफ ड्रग ऑन द बॉडी एंड द एक्शन ऑफ बॉडी ऑन द ड्रग, दैट इज ADME हमने पढ़ ली. फिर एफिकेसी और सेफ्टी तो आएगा ही, इट इज़ द एसेंस ऑफ इट. पोस्ट मार्केटिंग एंड केस रिपोर्ट फॉर्म्स आर ऑल्सो इंक्लूडेड, and biopharmaceutic studies are also included. Now all of these have individual की उसमें और भी कौन कौन सी studies या reports आपको भेजनी ही भेजनी है, वो भी इसके अंदर mentioned है, which we will study. So I talk about subsection of 5.3.1 where it talks about reports of biopharmaceutic studies. तो इसमें what are they asking or what is given there as per the guideline. So obviously this is 5.3.1.1. okay, So they're talking about bioavailability rate and extent up to which a drug is upstop, BA study reports. That is quite obvious कि अगर आपसे कोई बायोफार्मास्यूटिक स्टडीज़ मांग रहा है तो ऑब्वियसली BA स्टडीज़ मांग रहा होगा. नेक्स्ट दे आस्क ऑफ कंपेरेटिव BA and bioequivalence BE study reports. So BA की कंपेरेटिव स्टडी रिपोर्ट्स चाहिए रहती है उनको. 5.3.1.3 में दे नीड इन विट्रो इन विवो कोरिलेशन study reports. In vitro in vivo correlation study reports. Then 5.3.1.4 1.4 में उनको चाहिए reports of bioanalytical and analytical methods for human studies. तो यू डोंट नीड टू रटिफाई दिस, अंडरस्टैंड बाय लॉजिक कि अगर बायोफार्मास्यूटिक एक फार्मा बी फार्मा का सब्जेक्ट भी है तो उसमें हमने क्या बात की कि बायोफार्मास्यूटिक्स वाज ऑल अबाउट बायो अवेलेबिलिटी एंड बायो इक्विवेलेंस. तो ये दो चीज़ पहले दो पॉइंट्स में कवर हो जाती है कि बायो अवेलेबिलिटी इज़ क्वाइट इंपॉर्टेंट. तो वो इस पॉइंट 1 में ही कवर होगी कि उससे रिलेटेड कोई भी स्टडी रिपोर्ट हो तो वो इस सेक्शन के अंडर आपको देनी है. अगर कोई कंपेरेटिव स्टडी है दैट इज अबाउट BA एंड बायो इक्विवेलेंस एंड BA comparative study reports, then it needs to be mentioned in 5.3.1.2. If there is a study report related to in vitro in vivo correlation, again it's related to bioavailability, then it needs to be mentioned in the subsection like 5.3.1.3. And if there is a report of bioanalytical or analytical methods for human use, then in this particular section 5.3.1.4. फिर next आता है 5.3.2. This section was about what? Study reports pertinent to pharmacokinetics. Study reports pertinent to pharmacokinetics using human biomaterials. इसमें क्या आएगा? मतलब कि हमारे को बात करनी है फार्माकोकाइनेटिक्स की, बट वी हैव यूज द ह्यूमन बायोमटेरियल. इन दैट वी हैव 5.3.2.1 में प्लाज्मा प्रोटीन बाइंडिंग स्टडी रिपोर्ट्स. प्लाज्मा इट्स अ ह्यूमन बायोमटेरियल. प्लाज्मा प्रोटीन बाइंडिंग की स्टडी रिपोर्ट्स. फिर 5.3.2.2 में रिपोर्ट्स ऑफ हेपाटिक मेटाबॉलिज्म. रिपोर्ट्स ऑफ हेपाटिक मेटाबॉलिज्म and drug interaction studies. Then 5.3.2.3 में आता है reports of studies using other human biomaterial. Reports of studies using other human biomaterials. अब आप इसको कैसे, you don't again have to ratify it. See, whenever you ask someone who is giving lecture on these modules, no one will recommend that you ratify it, that you should have it on your fingertips. I have read this particular module just 2 times. I have not worked on it personally, but I've taught it 2 times and read it 1 time before teaching. And by doing that only, I remember now like 80% of it. Okay, this is that, and all based on logic and practice. So when you will be filing CTDs, and it will be your daily task, at the end of the day you would not be required to ratify it. No one expects from you to ratify it because you have to follow the guidelines while filing all these. And the main thing is that for interview purposes also, main things, just the ideas. I have not seen many people who have said that no, you should have word by word, you should have it in your mind. No. So how we are going to learn this is basically बार बार repeat हो रहा है कि studies pertinent to pharmacokinetics. What is the effect of body on that particular drug? So basically we are talking about what? ADME. So plasma protein binding of the drug talks about absorption pretty much. Reports of hepatic metabolism लिवर का मेटाबॉलिज्म का रिलेशन, व्हाट इज liver doing to that drug. So we are talking about metabolism here, drug interaction studies, and lastly, very easy, if there is any other study related to human biomaterials. So here is the end of subsection 2, that is report studies pertinent to pharmacokinetics using human biomaterial. Next comes is 5.3.3, that is reports of human pharmacokinetic studies. Reports of human pharmacokinetic studies. अब इसमें क्या क्या आता है? Pharmacokinetic means again 5.3.3.1 healthy subject PK. Okay, healthy subject PK. अब मैं आपको इसको कंपेरेटिव वे में समझाऊंगी. और 5.3.2 में पेशेंट सब्जेक्ट PK. अब आपको पता होगा क्लिनिकल ट्रायल जब होता है तो फेज़ 1 क्लिनिकल ट्रायल जो है वो हेल्दी पीपल पे होता है, और फेज़ 2 जो होता है दैट इज़ ऑन पेशेंट्स. ओके, तो इसमें इन्होंने जो स्टडी रिपोर्ट्स एक्सपेक्ट करते हैं दैट इज़ the related to pharmacokinetic is the pharmacokinetic of healthy subjects and pharmacokinetic of patient subject, and the common point in both is initial tolerability study report. This is common in both. So how it is written in the guidelines: healthy subject PK and initial tolerability study report, and patient subject PK and initial tolerability study report. Then 5.3.3 is intrinsic factor PK. Intrinsic factor PK study reports. And 5.3.4 is, क्योंकि हम बात कर रहे हैं क्या कंपेरेटिव वे में लर्न करने की, तो इंट्रिंसिक फैक्टर PK. और 5.3.3.4 में आ जाएगा एक्सट्रिंसिक फैक्टर PK. सो एक्सट्रिंसिक फैक्टर्स क्या है? एक्सट्रिंसिक फैक्टर्स मतलब कि फैक्टर्स दैट इन्फ्लुएंस फ्रॉम आउटसाइड, और इंट्रिंसिक मतलब कि दैट इन्फ्लुएंस फ्रॉम इनसाइड, दैट इज योर एज, जेंडर, जेनेटिक्स एंड डिजीज स्टेट आर एग्जाम्पल ऑफ इंट्रिंसिक फैक्टर्स. एक्सट्रिंसिक क्या हुए? एग्जाम्पल इंक्लूड कॉन्कोमिटेंट मेडिसिन यानी कि ड्रग इंटरैक्शन, या फिर फूड या बेवरेज इंटरैक्शन, और एल्कोहल इंटरैक्शन विद द ड्रग, और स्मोकिंग और माल न्यूट्रिशन, वाटर डिप्रिवेशन, या इन्वायरमेंटल इंटरैक्शन विद द ड्रग. So major PK intrinsic factors include what? Sex, age, weight, organ function, choroid diseases. All right. And extrinsic हमने बात ही कर ली है कि ड्रग इंटरैक्शन और ड्रग फूड इंटरैक्शन और other environmental factors, or if you have like drinking or smoking, then that interaction. So this is pretty much about. Lastly आता है 5.3.5. So that is population PK study reports. So this is pretty much about reports of human pharmacokinetic studies. healthy और patient subject का PK and initial tolerability study report. Intrinsic and extrinsic factor का PK और population PK का study report. Now moving on, next is the next subsection 5.3.4. अब जैसे यहाँ पे हमने पढ़ा reports of human pharmacokinetic study, हम यहाँ पे पढ़ेंगे reports of human pharmacodynamic studies. ओके, तो यहाँ पर आएगा 5.3.4.1. वेरी इजी, हेल्दी सब्जेक्ट PD. ठीक है, इसमें दोनों को साथ में पढ़ते हैं. 4.2. So we'll learn it by, as previously stated in pharmacokinetics, they look for the pharmacokinetic of both healthy subject and patient subject. Here also in pharmacodynamic, both the pharmacodynamic study reports is looked for healthy subject and patient subject. With that, they also look for the pharmacokinetic and PK/PD study reports for both healthy subjects and patient subjects. See, little bit easier it's made. Lastly, 5.3.5 is efficacy, reports of efficacy and safety studies. Reports of efficacy and safety studies. Study reports of controlled clinical studies pertinent to claimed indication. So first point in this, because it's of importance, based on this, a new drug or a novel drug study is based on efficacy to prove the efficacy and safety only. So 5.3.5.1 point indicates study reports of controlled clinical studies in relation to pertinent to claimed indication. So that drug product might have some claimed indication, and in order to prove that claim indication, whatever controlled clinical studies that were taken place will be mentioned in section 5.3.5.1. So here we are talking about, next is study reports. 5.3.5.2 study reports of uncontrolled clinical studies, and 5.3.5.3 is reports of analysis of data from more than one study. 5.3.5.4 is other clinical study. So here in the first point we are talking about controlled clinical studies, and in point 2 we are talking about uncontrolled clinical studies. So this clears, if someone asks you that which module content, they'll never ask to the detail where you have to mention the section also or subsection also, but they can ask you like efficacy safety data किस मॉड्यूल में मेंशन रहता है, कंट्रोल क्लिनिकल स्टडी रिलेटेड टू द क्लेम इंडिकेशन किस सेक्शन में प्रेजेंट रहता है, या स्टडी रिपोर्ट्स ऑफ अनकंट्रोल क्लिनिकल स्टडीज किस सेक्शन में प्रेजेंट रहता है, सो यू कैन किस मॉड्यूल में प्रेजेंट रहता है, तो यू कैन से मॉड्यूल 5. If by chance they ask which subsection, then you can know that it is subsection 5. Then if there is any analysis of data from more than one study, then it is mentioned in this point 5.3.5.3, and any other clinical study that will be mentioned in 5.4. Then 5.3.6 contains any reports of post-marketing experience. So any report related to post-market experience, quite self-explanatory. And 5.3.7 is related to CRFs, case report files or case report forms, and individual patient listing. So this is all the contents that is present in module 5. In my opinion, it is of important it is of an important use. So go through it. You can find it everywhere on Google. Just search it. I could have put a picture here of the same, but learning it on a pen and paper basis, because picture is available to all and picture can be studied by all, but learning and decoding it in this forms in a brief pattern is sufficient for you to understand initially of what mainly it contains. In the next video we will talk about the clinical study report and its contents in detail. So whatever you have learned here, उसका डिटेलिंग में हम पढ़ेंगे आने वाले वीडियोस में. टिल देन प्लीज लाइक, शेयर, सब्सक्राइब, turn on the post notification. Thank you for watching my video. Have a good day.